Ken Starr, wanted to take a minute and tell you about the Bernese method. What is the Bernese method? Basically, it's using micro doses of Suboxone as a form of induction to get people stable. So here's the problem. When people are on full opiates like heroin or methadone or oxy or whatever, historically we've had to tell them, look, you need to get off those opiates, you need to go into withdrawal, and then you can start Suboxone. So depending on the treatment center, they might want you down to 30 milligrams a day of methadone, which may be difficult if you're higher than that. Some centers may use 60 and then say, hey, we're going to wait 3 days, then you start to have withdrawal, we're going to start low doses of Suboxone. Or if somebody's using heroin or fentanyl, when you go into withdrawal, you can start using Suboxone. Even with the best laid plans, some people don't do well with that. Even small doses, starting with 2 milligrams, they have precipitated withdrawal. So this is a challenge for people, okay? This is called induction. Getting people onto Suboxone from whatever they were using before is called induction. So the process of induction is hard because people need to stop doing what they're doing, they need to tolerate withdrawal, and they need to get onto Bupe. So there's a novel system called the Bernese method from Bernese, Switzerland. And a paper came out. It's not exactly the best, case reviewed standard, but it came out in Substance Abuse and Rehabilitation, July 2016. What this method does, which is really interesting, is they basically, while a patient is on a full agonist opiate, while they're on a regular opiate, you introduce little tiny microscopic homeopathic doses of buprenorphine, like 0.25, maybe as high as 0.5. Well, if someone's stable on methadone or stable on heroin, if you give them a super low dose of buprenorphine, it doesn't precipitate withdrawal. So the idea is you kind of plant that seed, you kind of dust that receptor. It lasts for a little while. Then you do it again, maybe a day later or 12 hours later with a small amount. And gradually over several days or weeks, you build up the amount of buprenorphine while they're staying on the regular opiate, okay? And what this does is it gradually creates a presence where then they can stop the regular opiate and they're at therapeutic levels of buprenorphine. I don't think a ton of patients have gone through this process. The case study involved 2 patients. I personally have had patients who do this, and it seems to work. So again, it's not the standard of care, but keep that in mind if you or someone you're taking care of or care about wants to get on the Suboxone, wants to get on the buprenorphine, but is just having a lot of trouble doing so. It's called the Bernese method. And basically it's microdosing buprenorphine while you take opiates, okay? To gradually get that level up so you don't have to stop opiates, have this horrible period of withdrawal, then try taking Bupe, maybe have precipitated withdrawal, maybe not, and then gradually build up. And you do that and then it's still 2 or 3 days before you're feeling good. So you can use microdoses of Suboxone or buprenorphine while you're using opiates to gradually build your system up. Now this process can be as quick as a week, I've seen it. And one patient in that paper, it took a month. So again, it's not for everybody. I want you to know about it, what it is, who can do it, who shouldn't. All right.